In hospitals, more than 90% of admitted patients receive an intravenous drip because it's one of the most universal medical procedures. Intravenous therapy means delivering fluids, electrolytes, or medications directly into a vein. And the whole purpose of this method is simple. It is designed to stabilize body quickly, especially when time matters. It restores circulation, corrects dehydration, fixes electrolyte imbalance, delivers medications that the person cannot take through the mouth, and supports the body when someone is unable to drink, swallow, or absorb anything. Intravenous infusions create a fast effect because medication reaches peak level in 1 minute, while the pill usually needs around 1 hour, sometimes more, sometimes less. This speed is life-saving in some cases, but it's no benefit in mild situations. That's why it's important to understand when intravenous therapy is necessary, in what cases it's crucial, and what cases it gives no meaningful advantages. The first and most common indication of intravenous therapy is severe dehydration. When vomiting or diarrhea becomes intense, the body loses water, sodium, potassium, and chloride faster than intestine can absorb them. The stomach becomes irritated, the intestines loses its stability, and fluid rushes through the gut too quickly. At this moment, the body is unable to compensate, and ordinary drinking no longer restores the loss. The easiest way to understand that oral intake is failing is to watch for these four most reliable signs. The first sign is persistent vomiting. When the person vomits almost everything they drink, if even small sips of water comes back within 10 to 15 minutes, it's a strong indication that oral rehydration will not work. The second sign is very frequent watery diarrhea, more than 8 to 10 times per day, because the intestines cannot slow the fluid loss. Even if person drinks, the body loses much more than it gains. The third sign is visible dehydration, such as dry mouth, dizziness when standing, dark concentrated urine, or minimal urine output, which appears because circulating blood volume is dropping. The fourth sign is weakness, rapid heart rate, or confusion, which signals that electrolytes such as sodium and potassium are already falling and the heart can become unstable. When these signs appear, the goal of intravenous therapy is to restore the bloodstream quickly. In most cases, infusion contains water, sodium, and chloride in form of normal saline. Sometimes potassium is added to stabilize heart rhythm and muscle function, but potassium is always infused slowly and carefully because rapid concentration can be dangerous for the heart. Another important solution is Ringer's lactate, which contains sodium chloride, potassium, calcium, and lactate. It's used when patient has lost a large amount of fluid and electrolytes and needs more balanced replacement. The lactate is converted by the liver into bicarbonate and helps correct the mild metabolic acidosis that often appears during severe dehydration. The second major indication of intravenous therapy is when person is unable to take medications through the digestive system. During severe infection, post-surgical recovery, pancreatitis, or uncontrolled nausea, the stomach slows down and the intestines becomes unreliable. The acidity changes, the muscles of the gut stop moving normally, and the absorption surface becomes unstable. At this moment, pills become almost useless because they cannot enter bloodstream efficiently. Direct delivery is especially important for strong antibiotics, sepsis therapy, post-surgical pain control, and medications that must reach a therapeutic level quickly. In pneumonia, kidney infection, or skin infections like cellulitis, weak antibiotic level may slow recovery, worsen the infection, or even contribute to bacterial resistance. The third important indication is severe pain that cannot be controlled by oral medication. This often happens in renal colic, pancreatitis, severe migraines, and intense post-surgical pain, where the person needs fast relief and oral intake is too slow or ineffective. The fourth major indication is acute medical emergencies, when body circulation becomes unstable. One of the most dramatic examples is severe allergic reaction, when immune system release massive amount of histamine and inflammatory chemicals. Within minutes, the person may develop low blood pressure, chest tightness, difficulty breathing, or dangerous swelling in the airways. At this point, swallowing pills is impossible and also meaningless because gut cannot absorb anything during shock. Intravenous therapy delivers fluids, antihistamines, and sometimes corticosteroids directly into the bloodstream, while adrenaline opens the airways and stabilizes the heart. Another indication is chemotherapy, when medications used to fight cancer are too strong, too irritating, or too toxic to enter through stomach. Chemotherapy drugs target rapidly dividing cells, and the digestive system is one of the most sensitive tissue in the body. If these medications were taken by mouth, they would damage the stomach and intestines before reaching the bloodstream. This is why almost all chemotherapy is delivered intravenously. What surprises many people is that although intravenous therapy is one of the most universal medical procedures, it's overused in many situations where it offers no important benefits over ordinary drinking or oral medications. The first and most unnecessary use of intravenous therapy is mild dehydration without vomiting or diarrhea. When a person can drink normally, stomach absorbs water efficiently, and the food volume covers without any need for vein. And the blood volume recovers without any need for a vein. In these cases, the intravenous drip adds no meaningful advantage and only gives illusion of faster recovery. The second unnecessary use is the simple hangover. In a classical hangovers, the problem is not severe dehydration, but the accumulation of toxic alcohol metabolites. The stomach is usually stable, and most people can drink water, juice, or electrolyte solutions without difficulty. Intravenous therapy may feel refreshing because it delivers cold fluid quickly, but it does not remove alcohol or clear toxins faster. The liver works at the same speed regardless of oral or intravenous hydration. In more than 90% of hangover cases, intravenous drip changes only feeling of comfort, not the speed of recovery. Another unnecessary indication is use of intravenous for immune boosting or detox. These infusions often contain fluids, vitamins, and antioxidants, but there is no medical condition where a healthy immune system becomes stronger because of temporary pass of vitamins through the vein. Immunity depends on sleep, nutrition, stress, balance, and infection control, the brief infusions. The next commonly unnecessary use intravenous therapy is fatigue, stress, and low energy without any medical illness. In these cases, person is not dehydrated, the electrolytes are normal, and circulation is stable. Tiredness caused by lack of sleep anxiety, or long work days cannot be corrected through a vein. Oral fluids, rest, nutrition, and recovery gives the body everything it needs. Intravenous therapy is a powerful medical tool. It saves life during dehydration, infection, shock, or chemotherapy. But like any tool, when used without a clear purpose, it adds nothing to recovery. Understanding when it helps and when it does not help, people avoid unnecessary procedures and focus on what is truly stabilizes the body.